Hey, I'm Dr. Kyle Konis with Shift Health Center, and prospective patients often want to know, how does this process work? From start to finish, how does this look and what can I expect? So typically when you first reach out to us, what we'll do is book an initial touch point, which could either be a discovery call or it could be an in-person visit. But essentially we need to start off with some type of consultation. That can involve a deep dive into medical history, consultation into symptoms, seeing what's going on, what medications are you taking, what treatments have you already tried for this condition that you're suffering with. So typically we have to start out gathering information. That's really the first step. Once we get everything from there, we then need to dive into some comprehensive testing. Now, the comprehensive testing can look different depending on what condition you're suffering with, but nonetheless, we have to go through evidence-based and research-based testing to try to get a baseline of where we're at and try to identify where's the core dysfunction, where's the root cause coming from. That's the number one thing we have to identify between the consultation and the comprehensive testing that we'll do. From there, typically we have what we call a report of findings, where we'll sit down after our whole team of doctors and staff have had a chance to review all of the information. They'll come together and say, okay, here's what we got. Here's what we think's going on. Either do we think we can help this person, or do we think this is not in our wheelhouse? If we think we can help, we go over the report of findings of here's what we found, here's what we're recommending in terms of a custom treatment plan for you moving forward, here's how long that plan will take, here's expected results, here's how much any out-of-pocket costs are. So we give you all that information up front so that way you have it. And then from there, you can just decide if you want to move forward and attack this from a treatment plan perspective, or if you are wanting to wait for another time, whatever you want to do, we can make that happen. And so that's kind of the process. From there, we're going to go through the treatment plan. We always have re-examinations along the way as part of our treatment plans to make sure that we're getting that progress that we want to see and to make sure we don't need to alter anything on the fly. And then of course we do progress updates as we go, where we can retest with some of that comprehensive testing and make sure that we're getting the results that we want to be getting. And then from there, once we kind of get that crisis under control, we always have lifestyle optimization from there, which is more fine-tuning and tweaking of things like nutrition and sleep and lifestyle to make sure that people are vibrating at their highest level and living life the way they were designed to.